All right, so we'll get started now. Thanks everyone for joining me. So in this webinar, what I've really tried to do is to look at what factors are common to a lot of autoimmune diseases in regard to dietary and lifestyle advice and supplements that we can give to clients. Obviously, there is specific advice depending on the particular autoimmune disease, but we'll try and keep it general as much as possible, bearing in mind that a lot of clients do have more than one autoimmune disease. And obviously anything that we discuss in the webinar is additional to any management that they're getting from consultants. So we're not trying to take over management, but more to support them so that their condition is better controlled, and they may even be able to decrease medication because of that. But we do need to obviously work in conjunction with whichever consultant they're seeing. All right, so just a broad outline, we'll look at an overview of autoimmune diseases and their causes, and then how we can support them with diet, lifestyle, supplements, and then we'll just have a summary at the end. If you have any questions as we're going along, my colleague Dr. Nina Bailey is standing by looking at your questions in the question box. So do feel free to ask anything, and she may be able to answer you during the webinar. If we're not able to, then we'll get back to you after the webinar. All right, so autoimmune disease is definitely on the rise, especially in developed societies. So about 7% of the population in Western societies does have an autoimmune disease. Maybe even more, because they are sometimes complicated to diagnose, and the diagnosis can be delayed. They often present with vague symptoms, and takes a while before clinicians realize what disease is going on. So generally autoimmune diseases can't be cured, they can just be managed. And sometimes, or often, this involves harsh drugs with significant side effects. But the good news is that diet and lifestyle changes and supplements can make real benefits to managing these conditions. All right, so how does the immune system get so confused that it starts to attack our own bodies? So quite interestingly, it turns out that autoimmunity is actually a relatively common accident, and about 30% of people have measurable levels of autoantibodies at any one time. So our immune system has several methods for identifying autoimmunity and suppressing it. So what occurs in autoimmune disease isn't just that someone has circulating autoantibodies, but it's also the failure of the immune system to suppress the autoimmunity, along with stimulation of the immune system to attack, and the buildup of enough damage in cells or tissues to manifest as symptoms of disease. So the cause of autoimmunity is multifactorial. So there is a genetic susceptibility, and then one's environment also influences one's risk. And then there's a trigger. The trigger is often, but not always, something that increases, that affects gut function or increases gut permeability. So in terms of the environment, so one of the hypotheses of how autoimmunity develops is the hygiene hypothesis, which states that high standards of hygiene and good health care reduce the burden of infections, but because exposure to pathogens are limited, this can potentially cause dysfunction of the immune system because it hasn't learned how to deal properly with pathogens. Other environmental factors which are risk factors are northern climates, with lack of sunlight, which can lead to decreased vitamin D levels. Some other factors, so female gender, so many autoimmune conditions are more common in women, and in addition, hormonal changes can play a role in flare-ups in many of these conditions. stress, lack of sunlight we talked about, smoking, alcohol, obesity. So many autoimmune diseases are linked to obesity. And in fact, the only one that's of the common diseases that isn't is inflammatory bowel disease, because this disease does lead to weight loss with decreased food intake and diarrhea. So in terms of age, many autoimmune diseases first appear during the childbearing years. Then the Western diet, so a diet that's high in fat, especially saturated fat, high in sugar, high in protein and salt is a risk factor. Infections, especially Epstein-Barr virus, herpes simplex and E. coli have been implicated. And then the gut is one of the factors that can trigger an autoimmune response if there's gut dysbiosis or increased gut permeability. So the gut houses 80% of our immune system. And often in those with autoimmune disease, they have increased gut permeability. So the tight junctions that hold the gut lining together have become loose, allowing undigested food particles, microbes, toxins to enter the bloodstream, which can trigger an autoimmune response because they're recognized by the immune system as foreign invaders. So you can see with all these triggering factors, there is a lot we can do to influence someone's burden for developing autoimmunity. And the immune system is really just a balancing act. We wouldn't want someone's immune system to be so suppressed that on the one hand, they are more prone to developing cancer and infection. But we don't want it to be so overactive that they are at risk of allergic reactions and autoimmune disease. So there are more than 100 confirmed autoimmune diseases and many more that are suspected of having autoimmune origins. And which proteins, cells, and tissues are attacked determines the disease and its symptoms. So some diseases are organ-specific. So for example, Hashimoto's thyroiditis only affects the thyroid gland with destruction of thyroid tissue and hypothyroidism. And Graves' disease, which also attacks the thyroid gland, but causing hypothyroidism by stimulation of thyroid tissue. And then type 1 diabetes, which only affects the pancreas, so with antibodies destroying the beta cells, which make insulin. And multiple sclerosis, in which autoantibodies attack the myelin sheath around nerves, which gives symptoms like visual problems, numbness, tingling, bladder issues, weakness, loss of coordination. And then there are the autoimmune diseases which are systemic. So for example, systemic lupus, erythematosus, known as lupus commonly. So this affects many different parts of the body with symptoms such as joint pain, skin rashes, kidney problems, inflammation around the lung or heart, anemia, increased risk of clotting, memory problems, and more. And then another one is rheumatoid arthritis. So this isn't just limited to the joints. In addition to joints, people with rheumatoid arthritis may develop subcutaneous nodules, pleural effusions, so fluid around the lungs, inflammation around the heart, and other things. All right, so just a bit more about mechanisms causing an autoimmune response, and this is especially relevant for the adaptive immune response, so the B lymphocytes which make antibodies. So it could be because there's a foreign substance or microbe resembling body tissue. For example, in rheumatic fever, the proteins found in the group A strep bacteria resemble the proteins in the heart muscle, and as a result, antibodies attack the heart. And in Epstein-Barr virus, the similarity of the Epstein-Barr nuclear antigen is similar to the myelin surface proteins around the nerve, around the nerves. So in multiple sclerosis, that's why Epstein-Barr virus is a risk factor, because it can cause antibodies to the myelin sheath. Then body cells may actually be altered by viruses to look foreign to the body. Another mechanism is that if there's a substance that enters the bloodstream, even if it's part of the body but isn't usually in the bloodstream, the body can recognize that as a foreign substance. So for example, if the fluid within the eye enters the bloodstream, for example, during trauma, this could cause an autoimmune response. And the B cells, the B lymphocytes malfunction and make abnormal antibodies, which then attack various body tissues. Then looking at the innate immune response, so the T lymphocytes. So naive T cells can differentiate into one of many different kinds of T cells. So the ones that are most mentioned in autoimmunity, the ones that drive autoimmunity are T helper 1 cells and T helper 17 cells. And then the Treg cells suppress autoimmunity. So recent studies have identified many factors that influence the balance between T helper 17 and Treg cells. And this ranges from multiple signaling pathways, metabolic pathways, and also the microbiome influences this balance. And until 2005, scientists thought that it was actually the T helper 1, T helper 2 balance which determined autoimmunity. But now increasingly the T helper 17's role has come to the fore. So for example, multiple sclerosis patients are found to have elevated levels of interleukin-17, which is produced by Th17, in their blood and also in their cerebrospinal fluid, proving that T helper 17 cells penetrate the blood-brain barrier. And for rheumatoid arthritis, T helper 17 cells are higher in these patients compared to healthy controls. And the expression of interleukin-17 and other cytokines produced by these cells predict later joint destruction. So we'll hear more about factors that decrease or increase T helper 17 cells later on. And actually some of the emerging therapies are using anti-Th17 medication. So for example, in psoriasis, there's a medication, I'm not even going to try and pronounce the name, but it's an anti-interleukin-17 agent, which is produced by Th17. Right, and this slide just puts together a lot of the things that we've already talked about. So the Western diet influencing the microbiome, which influences the immune system. And then also just because genetic predisposition plays a role, and not everyone who eats the same diet will be predisposed to the same illnesses, and also environmental factors do influence the immune balance. So at the bottom, the Treg cells, if those go down and the T effector cells go up, this predisposes to autoimmunity. Let's look at how the diet influences things. All right, so gluten can influence autoimmune disease by 3 possible mechanisms. First, it causes intestinal permeability or leaky gut, as it triggers the release of zonulin in our intestines. So zonulin signals the tight junctions in our intestinal walls to open up, allowing microbes, toxins, proteins, and partially digested food particles through. And this actually happens in everyone, not just those with celiac disease or gluten intolerance. It's just that in certain people, it happens for longer than others. So that's it's Dr. Fasano's work, and it's an argument that maybe gluten isn't great for everybody, even though it's worse for some people than others. So secondly, gluten is highly inflammatory, burdening the immune system and causing oxidative stress. So if we're sensitive to gluten and we continue eating it, it causes chronic inflammation. And if the immune system is constantly dealing with chronic inflammation, it lacks the precision to deal with the invading pathogens with precision. And it might, instead of attacking them and fighting them off, it might sort of send out a broad wave of attack, which instead of just damaging the pathogen, also damages tissue in an autoimmune response. For those that are sensitive to gluten, entire avoidance of gluten is really important because eating gluten can cause an inflammatory response for up to 3 months, meaning that even if you only ate gluten 4 times a year, if you were sensitive, you could be in a constant state of inflammation. And then thirdly, due to molecular mimicry, so the gluten protein has a similar chemical structure to some of your body's tissues, especially the thyroid, which can lead to your body mistaking your tissues for gluten and attacking them. So there's several other food proteins, such as casein and dairy, that have a similar molecular structure to gluten. And because of this molecular mimicry, somebody who is sensitive to gluten, who develops antibodies to gluten, when they eat dairy with casein in it, their immune system can mistake this as gluten, and you can actually trigger the same autoimmune process. So that's why in those who can't tolerate gluten, often can't tolerate dairy as well. All right, so there are 2 ways that sodium can drive autoimmune disease. So it can activate the T helper 17 and T helper 1 cells, and can also activate the inflammatory monocytes and cause increased pro-inflammatory cytokines and decrease anti-inflammatory cytokines. So it has been shown in studies that, for example, in multiple sclerosis, those on a high salt diet had a 3-fold higher exacerbation rate and more new lesions on MRI. Salt also alters the gut microbiome, predisposing to obesity. So in our patients, it's really important to especially warn them about processed foods and takeaway foods. At home, we can control how much salt we add to our foods. And most people would probably think it's prudent not to add too much, but in processed foods and takeaway foods and ready prepared meals, we really have no control. That's those that we really want to ask our patients to decrease. And then glucose can also affect autoimmunity. So it has been shown in studies to activate T helper 17 cells and also increase mitochondrial reactive oxygen species, which leads to further immunological consequences, including T helper 17 cell-related inflammation. So dietary fat, obesity, and autoimmunity are linked in many ways. Just excuse this rather complicated diagram with my attempt to put it all together. So on the left, a raised omega-6 to omega-3 ratio can cause more inflammatory eicosanoids and activate the T helper 17 response. So omega-6 and omega-3 are always in a bit of a battle, and most people in the West have a raised omega-6 to 3 ratio. And raised omega-6 causes increased arachidonic acid, which tends to produce more of the inflammatory eicosanoids, whereas if you tip the balance towards omega-3, then you end up more with the anti-inflammatory and immune modulating eicosanoids. A high-fat diet can also alter the gut microbiome. And of course, this differs according to the type of fat. So it's especially the high saturated fat and inflammatory omega-6s. So this can lead to increased gut permeability and inflammation. So, interestingly enough, a high-fat diet doesn't only lead to obesity because of high calorie intake, but also the alterations in the gut microbiome can actually make the body able to harvest and absorb the calories from fat better because of the high-fat diet. So it's an additional way that leads to obesity. Obesity also increases the production of leptin. So leptin is an adipose-derived hormone which stimulates the production of reactive oxygen species, pro-inflammatory cytokines, and prostaglandins, and it suppresses the regulatory T cells. Just another way in which obesity can lead to autoimmune disease. And also a reason why fasting often leads to an improvement in autoimmune disease, because fasting decreases leptin. So interestingly, women have 2 to 3 times higher leptin in their blood than men when you adjust for age and body mass index. And this could be another reason why they are more susceptible to autoimmune disease. All right, so we're going to now look at different approaches which have been used to autoimmune disease and studies that have been done in them. All right, so the first one we'll look at is the Autoimmune Protocol. So the Autoimmune Protocol is an adaptation of the Paleo diet. So on the screen is the Paleo diet, which is a nutrient-dense whole food diet based on eating a variety of meats, seafood, eggs, vegetables, fruits, nuts, and seeds, including a focus on probiotic and fermented foods, and with the addition of herbs and spices. It excludes grains, legumes, conventional dairy products, and processed and refined foods. It aims to support the digestive system through the inclusion of prebiotic and probiotic foods and avoiding foods that contribute to gut dysbiosis. It supports the health of tissues that form the gut barrier by supplying essential nutrients and avoiding foods that are inherently difficult to digest or are known to irritate or damage the tissues that form the gut barrier, or that are known to stimulate the immune system. So the Paleo diet aims to reduce inflammation and support normal functioning of the immune system. So the Autoimmune Protocol is a stricter version of the Paleo diet. So it places greater emphasis on the most nutrient-dense foods in our food supply, including organ meat, seafood, bone broth, fermented foods, and vegetables. And it eliminates some foods endorsed by other healthy diets that have compounds that may stimulate the immune system or harm the gut. So that includes nightshades like tomatoes, peppers, aubergines, and white potatoes, eggs, nuts, seeds, and alcohol. So the goal is to give the body loads of nutrients while simultaneously avoiding any foods that might be contributing to disease. It also encourages fermented foods. So for example, fermented vegetables or fruit, kombucha, water kefir, coconut milk kefir, or coconut milk yogurt. And it has 3 phases. So the first is the elimination phase, in which clients gradually or more quickly, depending on how motivated they are, exclude all the prohibited foods. And then a maintenance phase, so in which they wait for their symptoms to improve and maybe stay on the diet for a little bit longer. And then a reintroduction phase where they stepwise introduce the foods that they have excluded and see whether they cause any reaction or symptoms. So there's certain foods that they would never recommend reintroducing, for example, gluten. But other foods, for example, nightshades, nuts or seeds, they would recommend that it gets reintroduced and the reaction monitored. So the pros about the autoimmune protocol is it is a good balanced diet, and it also addresses lifestyle factors. So it encourages sufficient sleep, stress management, and exercise. The cons are that it's a very restricted diet, so it's only for the super motivated, and those that don't follow it precisely can feel like a failure and become very obsessed with their diet, also to the detriment of focusing on other factors. And a less restricted diet might work all right for most other people. So let's have a look at studies that have been done on this. So this was a study of the efficacy of the autoimmune protocol diet for inflammatory bowel disease. So in the study, adults with active Crohn's disease and ulcerative colitis took part. So these patients had their illness for a mean duration of 19 years, and 47% were on active biological use. And their disease was active, so they had erosions on endoscopy or elevated fecal calprotectin levels. Calprotectin is a protein released by white blood cells in the intestine when there's inflammation in the gastrointestinal tract. So it's often raised in inflammatory bowel disease, and it can also be raised in other autoimmune diseases or in gut issues. So the results of this trial were really good. So this was only an 11-week trial. So patients had a 6 weeks transition onto the autoimmune protocol. So they gradually eliminated foods over the 6 weeks, followed by 5 weeks in a maintenance phase where they followed the diet 100%. And quite amazing results. The clinical remission was achieved by 73% of patients by week 6. And this was maintained through week 11. And the mean calprotectin decreased drastically. And this percentage of remission rivals most drugs for inflammatory bowel disease. So that was really very promising. The autoimmune protocol was also trialed in Hashimoto thyroiditis. So this was women who also had a 6-week transition onto the autoimmune protocol with a 4 weeks maintenance. They had significant improvement in quality of life and in symptoms, as well as in their blood markers, their CRP and their white cell count. All right, so in summary, a very difficult diet to follow, but can have really great clinical results. All right, so the specific carbohydrate diet, this is a diet developed in the 1920s by Dr. Sidney Haas, a pediatrician, as a treatment for celiac disease. And it eliminates various specific complex carbohydrates. These days, it's used a lot in pediatric inflammatory bowel disease, but can be used by some people to manage other conditions such as irritable bowel disease, cystic fibrosis, and autism. So included on the diet are animal products without additives, certain legumes, so dried beans, lentil, split peas, most nuts, certain dairy products, so encouraging homemade yogurt, most vegetables, all fruits, most nuts, oils, tea, coffee, and honey. And what's prohibited on this diet are sugar and sweeteners, grains, some of the legumes, seaweed, starchy tubers, additives, milk and milk products high in lactose. All right, so let's have a look at studies done on the specific carbohydrate diet in inflammatory bowel disease. So study by Dr. Stiskins in 2014. So this is children with Crohn's or no immunosuppressants who were on the diet for an average 14 months. All children were in clinical remission after 3 months, and their blood results normalized or significantly improved. Another study with children with Crohn's who were on the diet for 12 weeks showed clinical and mucosal improvement, And then inflammatory bowel disease patients answered surveys on whether they were on this diet or not. So in the last study here, and of the 417 people that responded, 33% said that following the diet, they were in remission at 2 months on the diet, and 42% were in remission after 6 months and 12 months of following the diet. All right, the next one we'll look at is the anti-inflammatory diet. So this is possibly quite in a way, easiest diet, I would say, maybe compared to well, definitely to the autoimmune protocol. So it's similar to the autoimmune protocol, but it includes nightshades, some dairy, soya, nuts. The only grain it does include is oats. Included is also stevia, maple syrup, local honey, and cocoa. So it decreases total unsaturated fats, eliminates hydrogenated oils, and encourages omega-3 rich foods. Also encourages pre and probiotic foods. So in the study, 40 patients with inflammatory bowel disease were offered the diet, and they wanted to see, first of all, what the uptake was and what the results would be. So a third chose not to attempt the diet, and the other 2/3 used the diet for 4 weeks and at 70% or more compliance. So it had a really great result. So 24 out of 27 patients had very good or good responses, with only 3 out of the 27 having mixed results. And 100% were able to decrease at least one medication due to the diet, and all of them decreased symptoms. So that was really great. All right. Then in multiple sclerosis, you might have heard of the Wahls Protocol. So this was developed by Dr. Terry Bowel, who developed multiple sclerosis herself. And it was really a protocol that she devised to improve her own health. So you can see there on the photos, she went from a wheelchair to riding a bicycle in a year. And this first trial was really to see whether the changes that she was able to get in her own health could be replicated in other patients. So in the study, they really wanted to test the feasibility of the study and looked at the effect on fatigue and multiple sclerosis. They didn't look at any blood or radiological features. So the diet in this protocol, it's a paleo-like diet, and also quite similar to the autoimmune protocol. So in this diet, 9 cups of vegetables per day are included. So 3 each of green, and it's counted as 3 cups if they're cooked greens. If they're raw, then 6 cups of raw greens, or 3 cooked. 3 cups of colorful vegetables, and 3 cups of sulfur-rich vegetables. Also included are animal and plant proteins. There was an optional fish oil supplement, 1 tablespoon of nutritional yeast a day. Kelp and algae are encouraged. No dairy, gluten, or eggs. And then in terms of non-glutinous grains or starchy foods, only 2 servings per week, so really low in those. And the protocol also included stretching and strengthening exercise, meditation, and massage. So this was a 1-year study, and there were 10 subjects. 8 of them completed the study, and 6 were fully adherent. So it was really quite a small study, but it was really just a feasibility study. So what was found was that patients adhered really well to the diet, so 90% of the days, exercise 75% of the days, and the average daily meditation and massage times you can see there. So with the chart, the one on the left is how the vegetable intake improved during the study. So you can see those really drastic improvements in that. And then the chart on the right, how the gluten, dairy, and egg consumption decreased during the study. Right, and so looking at fatigue, so the fatigue scores at baseline were at 5.7. The numbers don't mean too much to us because we don't, unless you understand that. But it went from 5.7 at baseline to 3.32 at 12 months. So on average, it was quite a good decrease, but less than half. So on the chart on the left shows how fatigue improved during the study. And then on the right is a chart that showed which nutrients increased the change in intake on the protocol and not on the protocol. So patients had a great increase in EPA and DHA, omega-3 fatty acid intake, increases in B12, iodine, lutein, and zeaxanthin, and some other nutrients. But there are also other approaches that have been used for multiple sclerosis. So fasting is one of the options that are looked at. So studies have looked at calorie restriction, intermittent fasting, fasting mimicking diets, and the ketogenic diet, all of ways of protecting neurons and reducing inflammation. And studies have shown that periodic fasting can improve cognitive function and reduce oxidative stress. So we'll just have a look at one of the studies. So in the study, multiple sclerosis patients were randomly allocated to 3 different groups with 20 patients in each group. So one group was provided 7 days of a fasting mimicking diet, followed by 6 months of the Mediterranean diet. In the second group, patients were on a ketogenic diet for 6 months, and then there was a third control group who just followed their normal diet. So if you're having a look at the chart, the pink's the control group. They didn't really show any difference in their symptoms. The light blue is the fasting mimicking diet, and the dark blue is the ketogenic diet. So the fasting mimicking diet was originally developed to improve health without the risks of a prolonged fast for 72 hours or more. And it appears to rejuvenate multiple systems within the body, systems involved in cancer, autoimmunity, and inflammation. So researchers believe that it works best if it's conducted in cycles. So this is because during the fast, the disease-causing immune cells are stopped and killed off. And then when normal feeding is resumed, normal immune cells and the myelin-producing oligodendrocytes are regenerated. So the fasting mimicking diet, patients had 800 calories on day 1, and then 200 to 350 calories on day 2 to 8. And food was then introduced stepwise from day 9 onwards. And in the ketogenic diet, patients had less than 50 grams of carbohydrates, more than 160 grams of fat a day, and up to 100 grams of protein daily. And the primary outcomes included quality of life, physical and mental health parameters as well. And participants also had blood taken for the analysis of white blood cells. So after 3 months on the study, there was a slight reduction in lymphocyte and white blood cell counts in the fasting mimicking diet group. However, this reduction reverted back to normal 3 months after switching to the Mediterranean diet, indicating that maybe cycles need to be repeated at least 3 monthly. There was no change in the lymphocyte count in the ketogenic diet group. And then if you looked at symptoms, the fasting mimicking diet improved symptoms generally more than the ketogenic diet did. And there's a bit of deep immunology, which we won't go through now, but you can look at later if you like. Right, then moving on to rheumatoid arthritis. in this autoimmune disease, it seems that the approach has often been sort of more vegetarian and vegan than in some of the other autoimmune diseases. All right, so in this study, they were looking at the effect of fasting followed by 1 year of a vegetarian diet. So 27 patients were allocated to a 4-week stay at a health farm. They did an initial 7 to 10 day subtotal fast where they could have tea, vegetable broth, and vegetable juices. Then they were put on an individually adjusted gluten-free vegan diet for 3 to 5 months, and then changed to a lacto-vegetarian diet for the remainder of the study. A control group stayed for 4 weeks at a convalescent home, but ate an ordinary diet throughout the whole study period. So after 4 weeks at the health farm, the diet group showed a significant improvement in the number of tender joints, swollen joints, pain score, duration of morning stiffness, grip strength, and their blood markers. But in the control group, only pain improved, but the rest of the parameters didn't improve. And the benefits in the diet group were still present after 1 year. All right. And then another study on a low-fat vegan diet in rheumatoid arthritis. So this was patients with an average age of 56 years who had moderate to severe arthritis. And the study was performed by a blinded rheumatologist who was blind to the study design and did pre and post-study evaluations. So for 4 weeks, patients had a very low-fat vegan diet. And the outcome was that there was significant decrease in almost all measures of rheumatoid arthritis symptomatology, along with a significant decrease in weight, which might have in itself helped with disease activity. And blood markers also decreased. All right, how about Crohn's disease? So this is a study done in Japan. And interestingly, in Japan, inflammatory bowel disease is considered a Western diet-related disease. And they regard it as due to increased animal protein, fat and sugar, bread, fast food, chocolate, and cola drinks, and decreased consumption of whole grains. And they feel that traditional Japanese food is preventative. And they surmise that diets rich in animal protein and animal fat cause a decrease in beneficial bacteria in the intestine. They're also very keen on green tea and brown rice for improving inflammatory bowel disease. And also they recognize that because most prebiotics are plants, they thought that a vegetarian diet would be most suitable for inflammatory bowel disease. But because they realized that excessive restriction in foods can be not terribly acceptable, they devised the semi-vegetarian diet, which they thought would be more sustainable long term. So in their hospital since 2003, basically for all their inflammatory bowel disease patients, they developed this diet which the patients followed while they were in hospital, and then they were discharged on the same diet. And I've seen some more photos of the diet. It's really an interesting diet, loads of traditional looking Japanese foods, which I don't know what they are, but they look really, interesting and exotic. All right, so interestingly, this semi-vegetarian diet is really rich in dietary fiber and quite the opposite to conventional low residue diets in inflammatory bowel disease. But they've had really great results in it. So in a study that they did, they took adults who had achieved medical or surgical remission of their Crohn's. And after 2 years on the diet, the remission rate was 94% versus 33% in the control group. So on their diet, patients are allowed fish once a week, meat once every 2 weeks, only a half-size portion. They encourage miso, yogurt, soya, rice, and potatoes, and especially green tea and unrefined brown rice. All right, so we'll move on to looking at some lifestyle factors now. All right, so we know that smoking is linked with many different diseases. In autoimmunity, it affects both the innate and the adaptive immune systems, increasing pro-inflammatory cytokines and decreasing anti-inflammatory cytokines, stimulating the production of autoantibodies and activating macrocytes and dendritic cells. Just to look at a few specific conditions, so in rheumatoid arthritis, there's increased susceptibility to develop rheumatoid arthritis and a higher incidence of rheumatoid factor antibodies. In Graves' disease, there's an increased risk of contracting Graves, as well as an increased severity of Graves' ophthalmology when the eyes are affected with Graves' disease. And in lupus, there are elevated antibody titers seen amongst smokers. Right. Then clients with autoimmune disease might feel like exercising less because their symptoms, understandably, can make them not feel like exercising. So chronic joint or muscle pains, fatigue, difficulty sleeping, weakness, headaches, and depression. But exercise is really beneficial for a few reasons. So if done at the right intensity, it can boost energy. Obviously, if it's done at too high intensity, it will have the opposite effect. So important not to over-exercise. It releases endorphins, which are a natural mood booster as well as a painkiller. It reduces inflammation, combats depression and anxiety, helps to manage weight. So exercises that might be chosen often, well, if clients have joint involvement, then they'd especially want to choose low impact activities that are easier on their joints. And exercises such as walking or walking on a treadmill, doing yoga, Pilates, lightweight training, and swimming. You know, I'm sure that you can help them find an exercise that matches their what they can actually do. So this is a review article that looked at physical activity, its safety, and its effect on immunity. So it's been shown that physical activity is shown to be safe in almost all autoimmune conditions. And the incidence of rheumatoid arthritis, multiple sclerosis, inflammatory bowel disease, and psoriasis, they've all been found to be higher in patients less engaged in physical activity. So during activity, interleukin-6 is released from muscles, and it induces an anti-inflammatory response through interleukin-10 secretion and interleukin-1b inhibition. And physically active patients with rheumatoid arthritis are found to have a milder disease course, better cardiovascular disease profile, improved joint mobility, and they have decreased fatigue, better mood, and better cognitive abilities and mobility. And then in lupus patients, they found that exercise improves quality of life, cardiovascular disease profile as well, and studies on type 1 diabetes have patients have a decreased risk of autonomic neuropathy and cardiovascular disease. And patients with fibromyalgia and systemic sclerosis were looked at as well, reporting decreased disease severity, pain, and better quality of life. All right, so chronic insomnia it's a risk factor for autoimmune development, and also vice versa. Patients with autoimmune conditions often have symptoms that do disturb their sleep. And they also have some autoimmune conditions are linked with other sleep abnormalities. So, for example, rheumatoid arthritis, ankylosing spondylitis, SLE, Sjogren's are all associated with increased sleep apnea. Multiple sclerosis is associated with an increased risk of rapid eye movement, sleep behavior disorder, and there's an increased risk of restless leg syndrome associated with autoimmune conditions. such as multiple sclerosis, psoriasis, and rheumatoid arthritis. And obviously chronic pain can also lead to disturbed sleep. So in a study by Zinn, he looked at the role of melatonin in autoimmune disease. So melatonin is produced by the pineal gland at nighttime, and it has multiple activities, including the regulation of circadian and seasonal rhythms and antioxidant and anti-inflammatory effects. And it can also modulate T helper 1-2 balance and cytokine production. And he found that melatonin dysregulation was involved in many autoimmune conditions. And melatonin supplementation has been shown in clinical trials to have a beneficial effect on many autoimmune conditions. So, for example, inflammatory bowel disease, type 1 diabetes, and multiple sclerosis. Just an exception, so it was found not to have benefits in rheumatoid arthritis or in males with lupus. If clients do have sleep abnormalities, it's maybe worth looking at that as to whether they could benefit from melatonin, both for their sleep but also for their disease activity. So stress in itself can be a trigger for autoimmune disease, and up to 80% of patients diagnosed reported an uncommon emotional stress before disease onset. And it can become a vicious circle because stress can trigger autoimmune disease, but in the same way, autoimmune disease can cause more stress and mental health issues. So it's really important to focus on stress reduction through whichever technique with our clients. So to, probably look at a variety of modalities and see what they can continue on a sustainable basis to decrease their stress levels, whether it's meditation, mindfulness, yoga, journaling, whatever they prefer. So this was a study which looked at mindfulness-based interventions. They looked at 20 randomized controlled trials that had mindfulness interventions, but then also blood draws looking at the immune response to meditation and mindfulness. So some of the studies, 40% of the studies had a control group. So they were given some other activities. So for example, exercise, sleep hygiene tips, group therapies, mind-body therapies, health education, and cognitive behavioral therapy. And the participants on these studies, some were autoimmune conditions, and there were also healthy volunteers and those that had risk factors for disease. All but 3 of the studies used mindfulness-based stress reduction or a program derived from that official course. So it's basically a weekly group class spanning 6 to 10 weeks, and then 40% also had an additional 1-day retreat. And so looking at the blood markers, it's really quite interesting. So as you can see there was reduction in the inflammatory markers and autoimmune disease markers, and even increased telomere length amongst those who followed these practices. So worth looking into that. And the techniques that were used in these studies were all based on this official MBSR course, which there are loads of centers all around that can teach clients these techniques. And they're all really nice because they're all backed by research. So well worth looking at. All right, this is just something slightly more esoteric that I came across. Some of you might have heard of Wim Hoff. So he is known as the Iceman. That's not a picture of him, that's just somebody else in the ice. So he's done several things, like he has hold world records for doing marathons in ice in just his shorts, and doing kind of daring outdoor cold events. But he's come up with this system, which is a combination of breathing exercises, cold water exposure, and meditation. And what he thinks is that these days we don't stress our body with natural stresses such as cold or warm. We dress according to the weather, and for cold we wrap ourselves up, we go in our cars or public transport, we try and avoid being outside. And a little bit like the hygiene hypothesis, I guess, but in terms of natural temperatures. So he thinks that because we're not stressing our body out with these natural stresses, our immune systems become dysfunctional and they overreact to, and situations that they shouldn't, causing autoimmunity. So he's had several studies done on himself and on other volunteers. But there was one study that was done on patients with autoimmune disease. So this is patients with spondyloarthritis. And they really followed his techniques, and they looked at the safety and the anti-inflammatory effects of following his techniques. And they found that it was safe for all of them, and their blood markers, their ESR and CRP and calprotectin declined relative to the control group. So that's just something that you can look into if you're interested in that as well. All right, in terms of supplements with autoimmune disease, let's have a look at those. So there's quite good evidence for omega-3, curcumin, and vitamin D. And then the last two are kind of optional, plus minus, maybe. All right, so omega-3, so there have been a number of clinical trials looking at the benefits of omega-3 in several inflammatory and autoimmune diseases in humans, including beneficial effects found in rheumatoid arthritis, Crohn's disease, ulcerative colitis, psoriasis, lupus, multiple sclerosis, and migraines. Many of the placebo-controlled trials of fish oil in chronic inflammatory disease reveal a significant benefit, including decreased disease activity and a lowered use of anti-inflammatory drugs. And when we're looking at omega-3s, it's really the EPA rather than the DHA that we think is the component that is really involved in modulating the immune system. So in the anti-inflammatory and anti-autoimmune activity that we see. So at Agenus, we would recommend that you choose a high EPA fish oil rather than a high DHA oil for autoimmune clients. This is just another study. I don't think we'll go through it too much in detail because our time's becoming a little bit short, but basically just a really beneficial role for omega-3s in many autoimmune diseases. All right, then curcumin, so the main active ingredient in turmeric. So curcumin plays a role in the anti-inflammatory response by inhibition of the COX-2 pathway and nuclear factor kappa B activation, decreasing that activation. It can be in a way compared to non-steroidal anti-inflammatory drugs, but it has nearly no side effects, making it a potential alternative or add-on to non-steroidals or to other medications with known severe adverse effects. So there are many studies that it has been done, shown benefits also in ulcerative colitis. 2 out of 3 studied, sorry. 2 out of 3 studies yielded significant improvement. The third study, it was a really low dose. So just to note that, you might need to use an effective dose or an optimized form of curcumin, which is better absorbed and more bioavailable. So in rheumatoid arthritis, one of the studies showed decreased disease activity. The other study was only 2 weeks long, and it didn't show effects. So maybe worth persisting a little bit longer before deciding whether it works or not. In patients with lupus with kidney involvement, this was a really low dose study, but given 3 times a day, curcumin decreased protein and blood in the urine and blood pressure. And then in multiple sclerosis, curcumin has been found to be able to restore expression patterns of dysregulated microRNA and also decrease T helper 17 and interleukin 17, which we mentioned before. All right, so increasing evidence demonstrates a strong association between vitamin D signaling and many biological processes that regulate immune responses. And it's been discovered that there are vitamin D receptors in multiple immune cells, such as monocytes, dendritic cells, and activated T cells, which means that vitamin D is able to modulate the immunological functions and play a role in both the prevention and management of autoimmune diseases. So vitamin D inhibits the pro-inflammatory activity of T helper 1 cells and their inflammatory cytokines. It also has an inhibitory effect on T cell proliferation and gene expression coding for mediators of inflammation. And it shifts the balance a little bit more towards a T helper 2 response, so that it's not so strongly that the inflammatory T helper 1 response. And it also improves the balance between T helper 17 and the T regulatory activity. So just in a few specific conditions, so in multiple sclerosis, it's definitely known that low vitamin D predisposes to development of multiple sclerosis. And it also affects the severity of the disease and the relapse rate. In type 1 diabetes, vitamin D supplementation reduces the risk of this in children who are at risk of developing type 1, so maybe a strong family history. And then also children and young adults who already have type 1 diabetes have found to have low vitamin D compared to those without. And there's a clinical study indicating that vitamin D supplementation was protective of the beta cells of the pancreas. In lupus, these clients tend to have low vitamin D levels because they tend to avoid the sunlight because they can get that photosensitive rash. So important to look at their vitamin D status. And a study has shown that vitamin D decreased fatigue, but not disease activity. However, in that study, 77% of patients still had vitamin D insufficiency by the end of the study, and most used 800 international units a day. So important to know that they might need a big dose of vitamin C, and important to monitor their response by looking at their blood levels. So the role of antioxidants in immune disease isn't fully researched yet. We don't really know if decreased antioxidant levels predispose to autoimmune conditions. We do know that there is increased oxidative stress in autoimmune conditions with free radicals which cause damage to cell membranes and tissues. So it's not certain if antioxidant supplementations are indicated or are indicated in all clients with autoimmune disease. But we also know that isolated antioxidants can become pro-oxidant in certain circumstances. So if they're in an environment of a lot of oxidative stress without other antioxidants to back them up. So if you do decide that you want to give your client an antioxidant, then astaxanthin is a really good choice. It is the most potent antioxidant, but importantly, it never becomes pro-oxidant. So it's quite unique in that it doesn't become pro-oxidant, and also it acts inside the cell, outside the cell, and within the cell membrane because of a unique structure that it has that spans the whole cell membrane. So it's antioxidant and anti-inflammatory. I hear some practitioners telling me that they, want to introduce a small amount of antioxidants. Well, this has quite flexible dosing. So one capsule has 4 milligrams of astaxanthin, and if you give one capsule a day, it's not a very high dose. It has been proven to be effective in clinical studies, but you could give one up to 3 times a day. So quite flexible dosing. And it also shows promise in pain and rheumatoid arthritis. All right, so probiotics also have achieved different amounts of success in different studies. There's a study suggesting that Lactobacillus reuteri shows benefit in multiple sclerosis, and BSL-3 is effective in ulcerative colitis, but not terribly much other good evidence. So up to you whether you try probiotics or not. I wouldn't say it's an essential, more focusing on gut health through diet, possibly. All right, and then just to touch briefly on metal toxicity. So it is a risk factor for autoimmunity, and different people react differently to the same amount of metal in their body. So those with amalgams, some people might be very sensitive to that level of mercury entering their system, and some might be able to cope with it. So in a way, it depends on your genetics and your individual detoxifying capacity, which may also depend on what else is going on in your environment and life at that time. So in this particular study, they looked at patients who were sensitive to metal. So they had the MELISA test, which showed increased antibodies to mercury. And in these patients who were sensitive, they removed their dental amalgams, and 71% of patients had an improvement in their autoimmune disease 6 months after amalgam removal. So just some things to think about. Also, of course, there are other toxins like toxic mold and other issues to think about. But too much maybe for an hour webinar. All right, so just in summary, the things that we've discussed. So if we were to put together all those different diets, there's certain generic elements that all of the diets would agree upon, and then the individual variations. So I think all of the diets would agree that one should try and achieve a healthy weight, prioritize gut health, cut out refined sugar and refined carbohydrates, and even with natural sugars, not overdo it. Avoid excessive salt, lower fat, especially saturated fat, and make sure that there is enough polyunsaturated omega-3s. Increase vegetable consumption, avoiding processed food, and avoiding gluten. So I think that all of the diets really agree on those factors. And then you might want to consider a specialized diet. And I think you can really be guided by research and client preferences. So I think many of these diets will achieve results in clients. So whether they choose one or the other, it's really down to which one you think in that particular condition has research evidence, and which one your client thinks that they can follow. And of course, you could try one for a certain length of time and then try another one and see which works better. So supplements, the ones with good evidence are omega-3, curcumin, and vitamin D, guided by blood levels. Remembering that in clients with autoimmune disease, we would want the blood level to be a little bit higher on the high side with vitamin D than someone without autoimmune disease. And then just something to look at and decide about is antioxidants and, for example, astaxanthin and probiotics. And then with lifestyle, definitely stop smoking. If they're smoking, try and optimize sleep. Think about asking about melatonin from their consultants if they're battling with sleep. Exercising at the correct level, and reducing stress by whichever mechanism. All right, so thanks very much for joining. That brings us to the end of the webinar. I hope that Lena has answered any questions you might have had, but if not, we'll get back to you at the end of the webinar.